is 12:02, so we can go ahead and get started. Thank you again, everyone, for joining. I will kick us off by turning it over to Paul Billings, who is the National Senior Vice President of Public Policy at the American Lung Association, to get us started. Thanks.
Thanks, Diana. And hello, everyone. I'm Paul Billings. I'm the Senior Vice President of Public Policy for the American Lung Association. And I'm so pleased you're joining us today. Welcome to our partners briefing for health, environment, environmental justice organizations on the American Lung Association's newest report, Boosting Health for Children. We released this report this morning to highlight the health benefits for kids of a future of zero-emission cars and trucks and electricity. We're excited to share the results with you. First, I want to express my appreciation for all of you if you're interested in your report and your tireless work to protect public health from dangerous air pollution. Many of you are familiar with our State of the Air report we release every April. State of the Air shines a spotlight on the problems of air pollution, and the 2023 report found that more than 1 in 3 Americans live with unhealthy levels of air pollution. And again, we found that communities of color bear a disproportionate burden of air pollution exposure. And I'll add as an aside, mark your calendars for April 24th when we'll release the 2024 State of the Air report, and we'll have a briefing just like this one. Today's report is the latest in our series that highlighting an important part of the solution to our air pollution and climate problem. The Lung Association places a very high priority on the transition to zero-emission vehicles and zero-emission electricity. That's why we're pushing so hard for strong federal rules to help get to that clean future. That's why, building on our previous reports on this topic, we're releasing today's report to look specifically at kids' health. As our leaders in Washington make critical final decisions, we hope that the cleanup of the nation's vehicles, we want to ensure protecting the health of kids everywhere is the North Star for the Biden administration. Please don't hesitate to reach out to the Lung Association if you have questions or thoughts after today's presentation and beyond. And finally, I'll close with a few quick logistical notes. First, we're recording this webinar. Second, please type your questions into the Q&A box throughout today's presentation, and we'll get to those questions after we finish our formal presentation. Finally, I'd like to thank my colleagues, Will Barrett, for his vision as the lead author of the report, and Diana Van Vliet for her role in drafting key components of the report, including the section on climate and on children's health. Finally, we look forward to hearing from you, so please include those questions in the Q&A box. Again, thank you so much for joining us today. And with that, I'll turn it back over to Diana Van Vliet. Diana?
Thank you, Paul. And I will just reiterate before we get started that we will have a Q&A at the end of the presentation today, and there's no need to wait. If you have a question that comes up during the presentation, please feel free to chat that into the Q&A box, and we'll take that at the end. So to start us off, I just want to share some context for today's report. So this report builds off of a 2022 Lung Association report, Zeroing In on Healthy Air, which is the source of this report. We use the same data set, and using that earlier analysis, we are highlighting the health benefits possible for people 18 years and younger through a scenario transitioning to 100% zero-emission sales of new cars and trucks and non-combustion electricity generation over the coming decades. This new report is focused on explaining the burdens of air pollution and climate change on children, the potential for health benefits on this vulnerable population, and strategies to move ahead. With that, we can jump into some air quality and climate context in the U.S. today. We will remind everyone that while we have made a lot of progress in cleaning up our air pollution is still a widespread problem. And our 2023 State of the Air report found that there are 120 million Americans, or more than 1 in 3, living in communities impacted by unhealthy levels of air pollution, including ozone and particle pollution. Decades of peer-reviewed literature highlight that there are major respiratory and other health risks associated with these pollutants, and we continue to want to bring attention to both the challenges and the solutions to these health harms. While While everyone, even healthy adults, are at risk from breathing air pollution, kids are uniquely vulnerable. This is because their bodies, including their lungs and their body's defenses against infection, are still developing. They also face more exposure to air pollution since they have a higher breathing rate and breathe more air per unit of body mass than adults. They also spend more time outside. Children face health harms from air pollution in both the short term and the long term, and exposure to air pollution can harm the development of a child's lungs. We also know that the burdens of poor air quality don't fall equally. There are major disparities in terms of who is breathing the worst air pollution. In last year's State of the Air report, we saw nationally that people of color were 64% more likely to live in a county with a failing grade and 3.7 times more likely to live in a county with 3 failing grades, or all grades failing, in the State of the Air report. And these are county level views. There are more refined data sets highlighting even more local disparities. And it's very important to note that the connection between air pollution, that there is a very important connection between air pollution and climate change. Climate change poses unprecedented threats to our health in many ways, including by degrading our air quality. More intense and frequent wildfires and longer wildfire seasons are contributing to massive amounts of particle pollution in the air. Additionally, ground level ozone pollution, also called smog, is more likely to form in warmer temperatures. So consequently, increasing temperatures are resulting in more ozone pollution or smog. This chart is really powerful. It is using data from National Oceanic and Atmospheric Administration's billion-dollar disaster data, and it is featured in the Boosting Health report. This shows data from 1980 through December 2023. You can see the concerning growth in major climate and weather events that put everyone in this country, especially kids, at significant risk. In 2023 alone, there were more of these events than previously reported, with mass evacuations, destruction, and disruption of kids' lives across the U.S. Just this reminder serves as a really stark visual as what we're dealing with in terms of how climate change is impacting the country, and it's important to think of the health impacts that come along with that. So I will now turn it over to Will Barrett, who is the Senior Director of Nationwide Clean Air Advocacy at the American Lung Association and the lead author of the report.
Thank you, Diana, and thanks everyone for taking the time to learn more about the report. I want to kind of walk through some of the methodology and assumptions we used to get to the data, and then I'll share that. But again, wanted to start with kind of what we used to build our scenario. So here you see we have targets set for 100% zero-emission passenger vehicle sales across the United States by 2035. For medium and heavy-duty vehicles, 100% of the new vehicle sales would be zero-emission by 2040. And then we also couple that with the transition of the nation's power grid to clean non-combustion technologies by 2035, and that tracks with the Biden administration's proposed decarbonization of the power grid by 2035. So with these assumptions for passenger vehicles and heavier duty vehicles moving to 100% zero-emission sales plus the power grid, we looked at between 2020 and 2050, as those technologies roll in, the cumulative health benefits of making this transition as we're reducing pollution across the country and what that translates to in terms of health benefits. Now, to get to the health benefits conclusions of the report, we used a series of modeling tools. Most of them have come from federal government agencies. So for developing our fleet model, we used the US EPA's MOVES modeling tool. For developing the power grid out to 2050, we used our consultants on this report, ICF, their model to help design what a power grid could look like with non-combustion technologies only. So wind, solar, battery storage, hydro, those kind of things. And then from there, we also looked at the upstream emissions, and we used the Department of Energy or Argonne National Labs GREET model to help identify the changes in emissions from this transition to cleaner technologies. And basically that all produces essentially a large volume of data related to the emission changes going from combustion technologies under sort of a business as usual case to our scenario for more zero emission technologies. So those changes in emissions are then fed into the US EPA's COBRA model, which produces on a county by county level health benefit analysis in terms of avoided cases of illness, as well as a monetized health value based on incidents per ton methodology that they use, which is based on peer-reviewed literature and epidemiology studies, and certainly very highly regarded tool. So again, just the baseline is our assumptions are fed into the modeling process, which then produces the results in the report. On the side of the transportation side of the report, we really want to emphasize the need for the transition to zero emission across both the light duty vehicle sector and the medium and heavy duty vehicle sector. In this slide, you'll really see that both sectors, basically passenger and up through the heaviest trucks, each can see major public health or emission reduction benefits through this transition to zero emission technology. So you see greenhouse gases and smog forming NOx or oxides of nitrogen dropping by 90% or more in both cases. For fine particle pollution, there's a significant drop, 58 to 68%. And that's a smaller drop than the other two pollutants because we're still accounting for, in our study, the impacts of brake wear from vehicle miles traveled and tire wear, again, from vehicle miles traveled. So as we're seeing the impacts of other sources of particles, we're not getting the same levels of results. So just wanted to highlight that. We're accounting for it, accounting for the benefits of regenerative braking, for example, on electric vehicles, but basically want to explain why we have a little bit of a difference in the pollutant changes. But again, significant changes across the board in the transition to zero emission technologies, 90% or more in some cases. Here we really want to highlight that, again, we need both sides of the coin, the heavy duty sector and the light duty sector, moving together to zero emission technologies. So on the right-hand side, you see, the heavy-duty vehicle sector is generating a significant share of the pollution on the road, but also the benefits in our study. So major reductions in smog-forming emissions from the heavy-duty sector moving increasingly to zero-emission technologies. The heavy-duty vehicle sector across the country represents 5 to 10% of the on-road fleet, but generates more than half of all the smog-forming and particle-forming emissions or NOx emissions in the United States. So really critical from a clean air, from a health equity perspective, that we keep the focus on zero-emission trucks while we're talking about the zero-emission technology transition. On the light-duty side, you see here again that the passenger vehicle fleet is a dominant source of greenhouse gas emissions in the country, and we need to address, obviously, our climate crisis, and a key way to do that is through stronger standards and stronger, more rapid transition to zero-emission technologies in the passenger vehicle fleet. So on our next slide, really the results of the original study, the Zeroing In on Healthy Air study, were staggering. We saw over 100,000 lives saved potentially out to 2050 through this transition to zero-emission technologies because the air will be that much cleaner. We saw over $1 trillion in public health benefits through our modeling process in that study, looking out to 2050 again, cumulative basis, looking at the emission changes across the United States, and really just highlighting just the staggering level of pollution burden today and what we can gain through this transition to zero-emission technologies. On the climate side, using the social cost of carbon, we also got to over $1 trillion, $1.7 trillion in global climate benefits because of the reduced carbon emissions in the United States. So these are global emission benefits, but based on the tens of billions of tons of pollution reduced over the 30-year window of our study. So again, staggering numbers from a broad national perspective, accounting for all of the population in the United States, except for Hawaii and Alaska, which are not included in the modeling tools. So for the children's health study we released today, we see, again, major public health benefits protecting our most vulnerable populations, our children. We see nearly 3 million asthma attacks avoided out to 2050 through this transition to zero-emission technologies. We see millions of other respiratory symptoms avoided, and critically, we see hundreds of infant lives saved. This is a really staggering number to us. We know that a single infant death is unspeakable. Here you see just kind of that visualized 508 times. These are the cases of infant mortality avoided out to 2050 by cleaning up the air. Now, on the other side of the coin, these are devastating health emergencies, impacts that are caused by pollution, and really what we're trying to convey, that there are major, major public health benefits out there that can reduce the emergencies impacting families, the devastation impacting families because of today's air pollution challenges, because of the reliance on fossil fuel technologies and combustion technologies in the transportation sector, in the power sector. Again, nearly 3 million asthma attacks avoided out to 2050 because our air will be that much cleaner through this transition. And again, these are, asthma attacks, these are things that send families to the emergency room. They send kids, prevent kids from getting to school. Parents have to stay home from work to care for their children in these extremely difficult, challenging times. So by avoiding these levels of health emergencies, we see a healthier future for our children. We see healthier children today. And again, as Diana noted, really the benefits of protecting children from our air quality crisis and our climate crisis, we just can't say enough about the importance of doing that. So with that, I thank you again for your time, and we'll turn it over to Laura Kate.
Hi, everybody. Thanks so much. My name is Laura Kate Bender, National Assistant Vice President for Healthy Air at the American Lung Association, and I will talk a little bit about the advocacy asks in the report, and then a couple ways that you can help us spread the word. So thank you so much. I'll start out by adding my thanks to all of you for being on, and of course for your tireless advocacy. We hope this report is useful. Our goal is always to make it useful, and I'll just say that we always love your feedback as to how we can make future reports more useful. So do be thinking about additional resources that you would find helpful to integrate this into your own work. Okay, so in terms of the advocacy asks associated with this report, there are two big ones at EPA, three big ones at EPA and one more general ask on infrastructure. That is not to say there are only 4 things that can be done to speed the transition to a zero-emission future. And in fact, at the state level, many states are adding in state-specific asks, like adopting the Advanced Clean Cars 2 standards. But I'll just flag these big ones for now. So number one, as many of you know, the Lung Association and all of you on this call likely have been calling for stronger, cleaner cars standards from EPA to make it across the finish line. So one of our key asks for the report is asking EPA to finalize strong multi-pollutant standards that will make future vehicles cleaner, applying to light-duty vehicles, so cars, SUVs, and light pickups, and medium-duty vehicles, bigger pickups, delivery vans, those types of vehicles. We have in place standards that go out through 2026. So these would be standards starting in 2027 that would make those future new vehicles less polluting. And not only would they be the strongest greenhouse gas emissions limits that the nation has seen, they would also add, strengthen the limits on other emissions so that we would see increasing shares of vehicles be zero emission, but for the gas-powered vehicles that are still being produced, they would be cleaner. They would have fewer particle pollution emissions and other emissions. This is currently under final review at the White House before hopefully being finalized in March. So we're calling with this report for President Biden and for EPA Administrator Regan to get it across the finish line. The second ask with the report is the exact same thing, but for trucks. EPA is also close to finalizing limits on greenhouse gases for heavy-duty vehicles, so buses, school and transit, big trucks. And again, those would start in model year 2027, making new trucks cleaner. These, of course, are critical for driving an increasing share of electric vehicles in the heavy-duty sector. And so we're eagerly awaiting a strong final rule for that as well. We also know that EPA needs to move to approve California's Stronger Cleaner Cars programs. As we highlight in the report, many states are out ahead of the federal government, setting strong advanced clean cars 2, advanced clean fleets, advanced clean trucks rather, and other vehicle emission standards. California can set them first, and then other states have the ability to opt in. But for all that to happen, EPA needs to approve a waiver of preemption for each of those programs. So we're calling on EPA, in addition to finalizing strong final cleaner cars and truck standards, to approve those waivers. And finally, we know that all of this needs to happen in the context of investment. We are seeing amazing investments from the Bipartisan Infrastructure Law and the Inflation Reduction Act into this nationwide transition to zero-emission vehicles, as well as electricity. And so we're working to ensure that we continue to see these investments roll out in charging infrastructure, incentives for individuals to purchase zero-emission new and used vehicles, investments in electricity generation, and zero-emission school buses, a great success story in terms of zero-emission heavy-duty vehicles. One other cool thing I'll highlight about the report this year is that we included some personal stories. We have a couple in there from physicians who are really on the front lines of the climate crisis. They treat patients, pediatric patients who are at risk from the health harms of traffic pollution, and who are at risk of the health harms of climate change. And many have seen patients who would normally come in with an asthma symptoms on a bad air day who are now having that happen more often in the changing climate. It's always important for us to shine a personal spotlight on these stories. So finally, before I turn it back over to Diana to answer any questions, which we are excited to do, I will offer a few ways that we'd love to see all of you engage. So number one, share the report. I will offer this with a caveat. At the moment, lung.org/EV is slow to load. So I'm going to drop for you a link directly to the PDF version of the report so you can dig in right now. That is up and running as we work out the very ill-timed kink with the website at the moment. But share the report. Share it on social media. Share it with your lists, with partners, with patients or your communities or your members. We want it to be a resource. And we want to highlight the fact that not only do we have these top line numbers, we also have state-by-state asthma attack avoided totals in the report, so you can make it more relevant for your audiences. Of course, we want you to use it in any advocacy that you are doing, particularly in support of stronger, cleaner cars and cleaner truck standards and others. So we encourage you to point people to the petition in the report that helps people take action. That petition will let people sign a letter calling on President Biden and EPA to finalize stronger, cleaner cars and cleaner truck standards. In just a moment, we will drop the link to that action for all of you as well. Two other additional resources I'll highlight here. Number one, as Will mentioned, this report builds on the Zeroing In on Healthy Air report that we originally put out in 2022. The technical documentation for that report underlies this report. And so if you ever want to dig in, really dig into the methodology, look at the details of the modeling, we have it. It's online under the additional resources drop-down menu at the bottom of the page of the report, or we can help you dig into it. But just know that if you ever have underlying questions about the data and methodology, we are here to help, and you can see that technical report online. And then finally, we're doing something a little bit different. We are also releasing with this report that will be up online shortly, 2 new fact sheets that are more public facing. I think obviously you all know us, you know that a lot of times our resources are policy and advocacy focused, as well they should be. But we thought this report was a good opportunity to take a step back and make the case for why electric vehicles make sense from a health perspective and also from a consumer perspective. So coming soon on the website and in your inboxes shortly will be 2 new fact sheets, one on the case for cleaner cars and one on the case for cleaner trucks. That's designed to meet folks where they are, address some common myths about EVs, and help build the overall case for why these vehicles are a critical part of our zero-emission future. And with that, I will turn it over to Diana Van Vliet to help us answer your questions.
Thanks, Laura Kate. All right, so I'll just remind folks, I'm seeing some questions come in, but please, we'd love to hear any questions you have. You can ask questions by entering them into the Q&A function of this platform. So I will start off by actually just really quick asking Laura Kate and Paul and Will just a reminder of when our State of the Year 2024 report is coming out.
State of the Air 2024 is coming out. Hang on, I just want to make extra sure I get this right.
Sorry, I could also
Coming
say
out on April 24th, 2024.
Thank you. Okay, great.
Easy date to remember.
Thank you. Question from Lauren Dudley. How was the model for health benefits created and what factors were included? So I think I will turn that to Will.
Thanks. Great question, Lauren. So the US EPA's health benefits model that we used is called COBRA. It's a co-benefits model. And what they do is take a basically incidence per ton methodology that essentially translate each tons of pollution that is entered into their model and translates that into a metric for how many cases of each pollutant would be, cases of each health endpoint would be avoided by reducing each pollutant. And each pollutant behaves differently based on the epidemiology studies that underline the EPA's model. The EPA has had their model reviewed by the National Academy of Sciences, and essentially it's based on significant levels of peer-reviewed research. And so what they are able to do is essentially, again, translate those specific pollutants being reduced under a certain policy scenario, for example, and translate that out to the population in each county in the United States. So based on local emission sources and that kind of thing, plus transported air quality or air pollution across county borders, they're able to look at essentially the concentration of pollution in that county, apply that to the county population, and then provide those health outcomes. And that it's similar for how they deal with the monetized value of those health endpoints. So hopefully that helps. There is some great material on the website for the COBRA model at EPA that kind of walks through all of the detailed process they go through to develop the model and then update it over time as the epidemiology studies progress or are reviewed. So hopefully that helps.
Thanks, Will. Next question is from Kathleen Clark. I really love this question. She says, thank you for your work on this. She's wondering if, although the L is for lung and the American Lung Association, have we ever considered including other health outcomes or working with other health organizations to include things like cardiovascular or reproductive outcomes?
I'll just say that the COBRA model does provide a broader range of health outcomes than we've included in our reports. I believe they have cardiovascular endpoints, heart attacks, and other non-health specific or lung health specific outcomes. So there are those data are available in the process or in the model, and certainly they're incredibly important to highlight. For our purposes, we haven't included those in this study, but I am fairly certain that those are included in a lot of the health analyses that are done by state agencies or the EPA when they put out their rule proposals. So the information is available and out there, but for our study, we haven't. Yeah, great question.
And I'll quickly just piggyback by saying that in the health section of this report, we definitely recognize that the health harms don't just stop at the lungs when it comes to air pollution and climate change. So we talk about how air pollution and climate change can impact, cardiovascular health and cause strokes and heart attacks. And we also focus on how pregnant people are especially vulnerable to both air pollution and climate change as well. But great question. Thank you. Next question is from Brian Zepka. Is there a breakdown of impacts by some of the vehicle subgroups, such as school buses? Well, I think you're on mute.
I think I just muted myself. So thanks, Brian. Great to hear your question. The short answer is no. We don't have it broken down by specific vehicle type. In the model, we did have on the medium and heavy duty vehicle side, we do have a breakdown of the different timelines for different vehicle types. I believe we had school buses moving to zero emission much more quickly than the 2040 endpoint for all vehicles. So we recognize the urgency and the importance of moving to zero emission school buses, for example. And we do point that out in the report recommendations on the policy front. But as far as a specific breakdown on health outcomes tied to each individual vehicle type, we don't have that.
Great. And I have a couple more questions. So why did we focus on kids in this report?
I can start because we know kids are at greater risk of both the conventional pollution harms from transportation, electricity from dirty sources, and from climate change. And I think the section of the report that details the disproportionate risk that kids face also really shines a spotlight on how that is more acute than ever. I think what we had in our heads as we began work on this report was the bevy of climate fueled disasters across the country that people had been facing, and just the knowledge that I'm sure everyone on this call suffered harms from those times, and that kids are among the most vulnerable and are at even greater risk in that context. And so we really wanted to shine a spotlight on kids' health. The report also comes out at a critical time for kids' health. We know that these policies at the Biden administration are almost across the finish line. We need to get them done. The cars and trucks rules, the California waiver approvals, and the infrastructure investments if we're going to see these benefits. So it is good timing from a policy perspective, building on very bad timing from a disaster perspective.
And just another question building off of the end of Laura Kate's answer here. News broke over the weekend that the Biden administration might be weakening their forthcoming clean cars rules. What does that mean for the goals in this report? Paul, do you want to start us off there?
Sure, thanks. Yeah, first of all, I've not been briefed on the final rule package, and I'm not aware of anybody in the NGO community who has been briefed on either the cars or the trucks final rule. But I think our report just reinforces the need to get these rules across the finish line because of the enormous health benefits that will accrue from cleaning up transportation to promoting zero emission transportation and electricity. We've seen industry launch multi-million-dollar campaigns attacking the standards that are under consideration. And so it's important for we as advocates to put forward the public health and addressing the climate crisis narrative to really help the American people understand what is at stake, and also to prod the Biden administration to finalize the strongest possible regulations. So we're certainly working the phones and working the press on this issue, but we think that the assumptions that are baked into our analysis can still align with the final rules that the administration hopefully will finalize. We think it's incumbent upon us to continue to advocate for the strongest possible rules. Laura Kate, Will, you want to add more?
Nope, nothing to add. That was it.
Thank you. I'm not seeing any other questions in the chat, so I'll just give folks a last call. Anything you would like to hear more about? Any questions? And while folks are thinking through, any final thoughts that any of you would like to share?
Yeah, while folks are typing, I'll just say, again, we really, really want this report, like all of our reports, to be useful to you. So if you have questions as you're digging in, let us know. We have additional resources, things like template letters to the editor and sample social, some of which you'll get more of today, that we would be happy to share if you'd like. So please reach out if you see ways that we could be more helpful in translating this information for the audiences you want to reach. And then also, if you'd like additional materials, we probably have them.
Thanks, Laura Kate. I see another question from Kathleen Clark. How does the Lung Association engage frontline communities in its advocacy?
I'll jump in if I could. This actually ties into one other thing I wanted to raise related to the waiver discussion, the EPA granting California waivers. So to Kathleen's question, as essentially, if we're looking at state level policies where I do a lot of my work, we have worked very closely with a lot of our partners in the environmental justice community, for example, in developing some of the rules that are currently pending now at US EPA, things like commercial hovercraft, where these vehicles or these vessels are polluting, frontline communities through, heavy diesel exhaust, for example, from tugboats, fishing boats, those kind of things, ferries, or the Advanced Clean Fleets regulation that Laura Kate mentioned earlier, where because EPA has not yet approved the waiver, the transition to zero-emission drayage trucks has not happened on time, basically, that it was supposed to for January 1st of this year. Similarly, the rule for small off-road engines, leaf blowers, lawnmowers, these kind of equipment were supposed to be only zero-emission sales in California as of January 1st. That waiver hasn't been approved. You can walk down to the hardware store and still buy the gas-powered versions. So to the question of frontline communities, we, again, have worked very closely within the coalitions that we're a part of to really understand where the communities are as far as the strength of the rules and making sure that we're working with them to understand, where they think rules fall short, where they can go further, that kind of thing. And now we're in the process of, having secured some, very strong victories together on California policy anyway, that now we're calling on EPA and Governor Newsom for that matter, to really get the benefits of these policies into the communities where they're designed to serve. So that means approval of the waiver so that California can implement the rules without further delay. That means for the governor of California to maintain his commitment to equitable distribution of zero-emission vehicle technology benefits. These are the kind of things that we're really working closely with, our colleagues in environmental justice organizations who are, really trying to put a really fine point on, yes, the Lung Association's report shows all of these benefits, but we know where the benefits can be significantly concentrated is where there are these major sources of pollution. And that's where, again, we spend a lot of our time trying to really crack that nut. So anyway, with that, it's a great question. Thank you for bringing it up.
And I see a question from Lindsay that I want to get back to, but just because this is we have another related question from Diana Harden. So similar to Kathleen's question, how will this research be directly implemented onto the Black and Brown communities affected? Anything to add on what you were just saying, Will?
I mean, ultimately, that we're trying to get the word out about the benefits of these policies. We are continuing to work with colleagues in these community, based organizations who are, really gathering the local flavor as far as what's going on in the community, what needs to happen to better protect health based on, where these sources of pollution are. And we want to make sure that, we're continuing that dialogue with our, partners in the community, space, as well as making sure that, these groups are also armed with the data that we're putting out about the level of air pollution in their community, which obviously is very well known to them, but also, what are the health benefits that we present that can be then used in their conversation with local elected officials, local air regulators, state or federal air regulators. And I think that's an important role, especially when we get into our State of the Air report and some of the discussion of disparities that we've tried to highlight, so that when people see this report, they're also hearing that message that there are significant disparities in who's most burdened by pollution. And again, I always come back to the truck side of things. There are 72 million people in the United States living in close proximity to major freight corridors. They tend to be people of color. They tend to be people with low incomes. And we actually did a whole report on that just a year ago. And we want to just continue to, impress upon the Biden administration, state and local governments, this transition to zero-emission technologies, cleaning up these engines that are doing so much local harm, really the urgency of that, it can't be understated. So thanks again for that question.
Yeah, just to build on that, sorry, Lorky, we have issued, this is the fourth report we've issued in this series. We hope that all 4 reports can be a resource for all advocates, but particularly advocates in communities that are already facing the greatest burden from air pollution. So the report we'll mention on trucks. We also did an earlier report on cars, and then the original report. We think that all these can provide powerful data to reinforce the argument for the adoption and implementation of these policies and to hold decision makers accountable. And then we'll also mention the State of the Air report, where we really, for the last several years, we really tried to focus on the health disparities associated with air pollution exposure in the United States, and why we can't breathe free until we can all breathe freely, and why it's so important to prioritize those communities that are facing the greatest burden with the policy interventions that are being proposed and adopted.
Not to belabor it, but I do want to add one more thing, which is to answer the question directly with your help. The Lung Association will obviously share this far and wide with not just the advocacy community that we work with, but also our colleagues that work with patients with lung disease, running COPD management clinics, asthma education. Obviously, we serve, a set of folks who are at greater risk of lung health harm, but so do all of you. So please help us get the word out to communities that you think would find this helpful, particularly those most impacted.
Thanks everyone. And Laura Kate, that's a great note to end on. I'm not seeing any additional questions. So I'll just say thank you all so much for joining today. I know everyone's really busy doing super important work. So we really appreciate your interest in this report. We hope you find it valuable and helpful. Reiterating Paul, let us know if you have any questions that come up while you're reading it or using any of these materials. We would love to find ways to